Hi and welcome to Optimum TV. I'm Stephen Adams and today I'm joined by Ulrik Mouritzen, CEO of Copenhagen-based Breye Therapeutics. Breye is developing an entirely new treatment for diabetic retinopathy. So hi Ulrik.
Hi, it's Stephen, and thank you for having me on.
Not at all. Let's get straight into it. What is diabetic retinopathy?
So diabetic retinopathy is the leading cause of blindness among working age adults. If you look at the core pathology, it's the high and fluctuating blood glucose levels that you see in patients with diabetes that cause stress on the capillary network. And that leads to vascular leakage and breakdown of the capillaries. It's a slowly progressing condition where over 10-15 years, patients lose more and more of their capillaries until they have kind of a hypoxic state in the eye, where that's driven neovascularization, proliferative disease, and the risk of going blind. So it's very much a large problem. If you look at it globally, there are 590 million patients with diabetes in this world, and that's growing to 1.3 billion over the next 25 years. And it's concerning to see, if you look across all type 1 and type 2 diabetes, about 1 out of 3 patients have signs of eye damage today. So it's very much a large and growing problem we're seeing.
And I guess besides the fact that we have an increasing diabetic population, we also have an aging population as well.
That is very much so, yes. And but also the recent studies show that even in young people that are going to live for many years with diabetes, you see these problems coming up. So it is very much needed to find better therapies.
Okay. Thinking about the current situation, how is diabetic retinopathy treated at the moment?
So the current therapies are based on needle injections administered directly into the eye. And they're only suited for patients with advanced disease. That means patients with proliferative disease or patients with edema to a point where they're complaining about vision. And so the treatment regimen is that during the first 6 months, you're giving 1 injection per month for the first 6 months, and thereafter patients can typically go with an injection every 3 to 4 months. That also means that it's quite burdensome of patients, and so statistics show that after 1 year, about half of the patients come back and complain to say, I can't tolerate these needle injections, and they become non-compliant. So there's a very large unmet medical need to find better and non-invasive therapies that could be used earlier in the intervention for these patients.
Before we talk about Breye's approach to diabetic retinopathy and your treatment, let's talk about diagnosis and early diagnosis, which is very important when it comes to lots of eye diseases. How is diabetic retinopathy currently diagnosed, and are we getting better at diagnosing it early?
Correct. As I said, it's very much a silent disease, so patients don't really complain until very late in the course of the disease. And that also means that all the treatment guidelines describe that you need to call in these patients once a year at least to see, do they have diabetic retinopathy? And luckily, we're getting better at finding more and more. We're being more adherent to the guidelines, but we're also getting help from the technological advancements, where today the regulatory agencies like FDA have approved equipment where you can take a photo into the back of the eye, and within minutes it gives this diagnosis, is this diabetic retinopathy or not? That also builds this gap between what we can detect and what we can treat, as the current therapies are only suited for advanced disease. And that's where we think that oral medications that could be applied at an earlier time point could make a very large and positive difference for the patients and their caregivers.
And tell me about your treatment, danegaptide, which I understand is an oral therapy.
It is exactly an oral therapy, and it works on the very core of the disease pathology. Specifically, it's a capsule therapy that patients would be taking in the morning, and it reaches the blood circulation and thereby the capillary network of the eye, where it's mechanistically stabilizing the cell-cell coupling in the capillaries, thereby reducing vascular leakage and protecting from capillary breakdown. And this medication has been tested in more than 500 humans, showing a very good safety profile. We have a quite strong preclinical package using both cell-based assays and animal work, showing that danegaptide can target the very core of the disease diabetic vascular leakage and breakdown of the capillaries. And we've just completed a phase 1b clinical study in patients with diabetic eye disease. And I'm happy to report that, again, we see excellent safety data. We see plasma concentrations of danegaptide in the targeted range, and we see early signs of clinical activity. So we think we're on a very valid path of progressing this into the next phase.
Okay, and so finally, Ulrik, tell me what's next in terms of Breye developing this very interesting molecule.
Yeah, so currently we are raising a Series A of 40 million euro in order to fund a phase 2 clinical proof of concept study. We will be treating patients for 6 months with this medication comparing to placebo, and we'll be using the clinically relevant and regulatory endpoint. We are very much following a described path for clinical and regulatory approval. Specifically, the FDA requires us to show a 2-step improvement on the disease score, which is both clinically meaningful and there is regulatory precedence to show that there have been drugs approved based on this endpoint. So over the next 3 years, we will be generating phase 2 clinical proof of concept data that will be directly phase 3 enabling. They will be transactional towards pharma, and they will show the potential of orally administered danegaptide to make a large and positive difference for the patients and the caregivers.
This molecule, finally, could make a huge difference to the quality of life of people with diabetic retinopathy, couldn't it?
I think so, and I think the convenience of if you can take this in the morning together with your anti-diabetic medications, and you can initiate treatment at an earlier time before you get to these late-stage pathologies where you need needle injections. I think all the stakeholders would be aligned in terms of the patients, but also the caregivers that see a lot of burden of treatment for these patients. So we think that this is something that really could make a very large difference for patients.
Ulrik Mouritzen, CEO of Breye Therapeutics, thanks very much indeed.
Thank you, and thank you for having me on. It's a pleasure.
Bye-bye.